Okay, so this next position is going to take a little bit of flexibility. You're going to have to be able to get into an S-leg position like that. Okay, so I'm going to take a little more shea butter here. I will also say, in the interest of full disclosure, I am not 100% on the science of this one. This is a thing that comes from Rolfing, from Ida Rolf and structural integration. Most of that stuff is pretty well researched in terms of fascial biology and fascial anatomy at this point, myofascial anatomy, whatever we're calling it now. But I don't know about this particular part. But, you know, suffice it to say, it seems to work when I do it. So that's the amount of evidence that I have for there, and full disclosure done. All right, so with this one, the object is, we dropped along the outside of the tissue, and now we're gonna lift on the medial side of the leg. So drop the lateral side, lift the medial side. So the reason we're doing this is, like, if you imagine the leg and the musculature of the leg as a pulley system, okay? So this side of the pulley is dropped, okay? So, or I'm sorry, this part of the pulley is pulled way, 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 way tight, and this part of the pulley is way overstretched. It's having to give a lot of slack here, okay? So what we want to do is, we want to lift up on the inside there and drop on the outside, okay? So I'm going to take another little bit of shea butter here, just a little bit, and with my proximal phalanges, I'm gonna dip again into the tissue, and leading with my thumb, I'm gonna pull upward, or push upward toward the knee, okay? And you can again couple that with this supination motion or inversion motion. And if you want to get more specific, you can get in there with the thumb, but just fair warning, these get into what are called the Tom, Dick, and Harry muscles, or that's how we remembered in the school, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. The deep posterior compartment that lives right on the back of the tibia here, very, very deep muscles. They are pretty spicy to work on, so work within your tolerance. Don't push against too much pain, okay? So if you do want to work on those guys, the evidence for doing so for this problem is really not so clear. Yeah, I'm not going to show that, actually. All right, so for now, just work up those guys. I don't know why I gender my muscles. I shouldn't do that. All right. Yeah, so you guys get or you folks get the idea. Sorry.